So breathing is by far one of the most talked about things in clinic for me with my patients, and particularly a lot of our pelvic health osteos at Total Balance Healthcare. A lot of us do not breathe that well. We have adopted really poor breathing mechanisms and mechanics throughout our life. So the reason why the breath is so important, particularly in pregnancy, is as our uterus grows, our baby grows, our organs get shifted into all different positions, but particularly up. So we can get a lot of shortness of breath, reflux, stiffness through the ribs and the mid-back. But also the diaphragm, which is our big breathing muscle, and the pelvic floor are linked. So when the diaphragm is moving well, the pelvic floor should be moving in synergy with it, so at the same time. Also, breath work in pregnancy can be great for getting some mobility through that diaphragm and the ribs. It is a brilliant tool in labour and birth as well, so practicing it in pregnancy can really come to fruition when we are giving birth. And then postpartum, getting into that really nice abdominal 3D rib breathing can be really beneficial because it helps us to connect back through our core and our pelvic floor in those early postpartum periods. So what I say to my patients and what I'm doing for myself is I place my hands on my lower ribs and I want us to take a nice big breath in, really focusing the start of that breath into our lateral ribs where my hands are, and I want us to imagine we're trying to push our hands away. You can also add in a towel around those ribs or even a really light TheraBand to give you a bit of feedback and resistance as well. Really great at getting us into that parasympathetic nervous system, so that rest and digest. I always say to my patients too, when you are getting that pregnancy insomnia at 2, 3, 4 a.m. in the morning, just lie in bed, do this breath work, and it really is quite calming. You can sometimes lull you back into sleep as well.